Welcome to our executive interview series at the Trellix Cybersecurity Summit presented by FedScoop and CyberScoop. I'm Wyatt Cash, and I'm pleased to be here with Andrea Palm, Deputy Secretary for the Department of Health and Human Services. Andrea, thank you so much for joining us.
Thanks for having me.
So I'd like to start by asking, we've seen a significant rise in incidents in healthcare in the last 5 years. What is HHS's overall strategy to help build cyber resilience in the healthcare sector?
Yeah, it's a great question. We recently released a strategy that includes 4 major pillars. The first is some cyber performance goals that allow organizations to understand in the healthcare space the kinds of things that they should do to be more protective and more resilient should they face a cyber attack, and then some enhanced practices that sort of take you from good to great to the next level. But we really want to make sure everybody gets to that floor of essential cybersecurity practices. We've proposed to Congress a program to provide financial assistance. We know there are a lot of healthcare providers that don't have the kind of balance sheets that give you the cushion to make the kind of cyber investments that would be necessary. So we're looking forward to working with Congress to get some money to do some work with the sector to really raise, again, all boats. Third, we know we've got to do more in the space of accountability and enforcement. The kind of incidents that exfiltrate patient data, that take hospitals offline so that we're really having patient safety issues are the kinds of things that we at HHS need to hold systems accountable for. And then finally, we really need to do the work as a federal government to be better coordinated. So we've long had a one-stop shop at HHS that is designed to help the sector, but we recognize we can and should do that better. We provide trainings through that. We have all sorts of bulletins and alerts and ways in which people can understand what's going on from a cyber perspective in the sector. But we want to make sure that there's one door for folks in the healthcare sector to come to should they need assistance in the cyberspace. And so that's a place where we also are doing quite a bit of work.
And then you mentioned forthcoming cybersecurity requirements for the healthcare sector, or things that you're continuing to move forward. Can you tell us a little bit more about what we might expect?
Mm-hmm. So as I noted, we released about a month ago these voluntary performance goals, cyber performance goals, the essential goals, and then the enhanced practices. And we anticipate that requirements will be based on those essential and enhanced practices, and that we'll use all of the levers that we have within HHS, whether it's our Medicaid and Medicare programs, whether it's our Office of Civil Rights Enforcement Authority that they have through the HIPAA security rule, to really embed those in the way that we do business across HHS as standards and requirements that we really bring to bear on the sector as we move this forward, but wanted to put them out as voluntary practices and standards to get some feedback, to understand implementation challenges before they were ever to become something that were requirements. But that certainly is where we're headed.
Well, we'll look forward to seeing that unfold in the months to come. Well, Andrea Palm, thank you so much for taking a few minutes here and joining us at the Trellix Cybersecurity Summit.
My pleasure. Thank you, Wyatt.